To be an hour and a half from the medical center of the world, as far as I'm concerned, is just amazing. And the care that you get in that medical center and the care I got in Memorial Hermann Hospital was second to none. My biggest passion is the practice of law. But I guess next to that, I really love to bass fish, and I really love to bird hunt. And to know that I'm going to be able to do that for years to come was just like a bonus to this whole process.
Here at Memorial Hermann, we have a very unique structural heart team, which consists of a multidisciplinary group of physicians. Our goal is to perform complex surgery through tiny incisions and provide either better or equal results as open heart surgery.
I had referred Larry to Dr. Smalling for his initial evaluation. I'd also met Dr. Wynn. Dr. Wynn is associated with Dr. Smalling. There was just a natural relationship for that referral to occur. They have an incredible team, from anesthesia to nursing, respiratory support, plus they have a hospital staff who are very attentive in caring to the patient.
Dr. Sweet's been my cardiologist for a number of years, and in 2012, he did an arteriogram to insert a stent in one of the arteries for my heart. And while he was there with the scope, he checked out my heart and discovered I had a congenital defect with my aortic valve. I was getting to a point where I actually needed to have the valve replaced.
Potential risk for everything from sudden death to microinfarction. It became important to do something fairly quickly that was as definitive for the relief of the aortic stenosis as we could.
And found that Mr. Hunter had a condition known as aortic stenosis, where the valve gets very tight and it limits blood flow to the rest of the body. We had Mr. Hunter come see us in our valve clinic and carefully examined him and discussed with him the various treatment options. Good morning. How are you guys doing? You doing all right? Long time no see. You ready for your surgery?
When Dr. Wynn walked in the room at Memorial Hermann, the first time I ever met him, it was an amazing meeting because he's very humble, yet so confident and so reassuring and knowledgeable, and I was glad I had him as my cardiac surgeon. We were trying to decide if I was a candidate for the minimally invasive procedure. In order to qualify for that, you can't have any blockage requiring bypass. Once it was determined that I had no blockage and I didn't have any other valve problems, simply the aortic valve, that qualified me.
Minimally invasive surgery was an excellent option for Mr. Hunter. He is a very active attorney, and quality of life is obviously very important for him. He wanted to go back and return to work as soon as possible. Minimally invasive surgery allows us to perform complex operations through tiny incisions that allow patients to return back to their normal day-to-day activity within a short amount of time. For someone like Mr. Hunter, who wanted to go back and return back to his law office and return back to his ranch as soon as possible, this is the ideal approach for him. Seeing Mr. Hunter before the operation, where he got tired easily, he got short of breath, and seeing him after the operation makes a world of difference, and gives me the peace of mind that I really made a difference in Mr. Hunter's life and his quality of life.
The recovery time was amazing. I was back at my office within 4 weeks, just really happy with the result.